I've been here since I started my GP career 4 years ago in 2016, and I've loved working here the whole time. Some of the things I love most is just we have such a wide variety of patients and a community that we serve. We have such a wonderful and strong community of basically sobriety, which is great, and working with those patients is amazing. We also have, our upper class Queen's Park people and everyone to our halfway houses and shelters, and it's just nice to be able to serve such a wide variety of patients and every day see people of all different races and walks of life is amazing.
My experience in this area was that you had, again, a good diverse population. It was just a nice place to do the training, so it was good to come back to a place that I knew was, I think, a little bit nicer to work in than the kind of pressure cooker mentality of Vancouver and some of the bigger centers versus a little more laid back out here.
Our colleagues, we connect really well, through division events, through, the networks we make at the hospital and the connections there. I have lots of colleagues in our community that I can call up and say, hey, look, I'm having trouble with something, can you, bounce an idea off of me and work with me. So I think that's one of the great perks of being here in our community.
I feel that we are well supported with the division in terms of our needs, communication, courses. Destiny basically brought me here, but I'm happy to be here.
I chose to come to POCO 26 years ago, and I'm still in the same office. The people, the Colombian is the main thing. It's a strong hospital. And I say this all the time, you ask anybody, you get sick, which hospital do you want to go to? And I guarantee you, a lot of people say, I want to go to Columbia, because they know that the people will get taken care of, and they have good doctors there.
I think the division has done so much for my practice. From the top, starting with helping us recruit, physicians and nurse practitioners to join our office. They've been there, hand in hand. We had a couple of physicians, retire within, short notice of each other, and we were sort of panicked to what are we going to do? And the division stepped in right away to walk us through that, as I said, hold our hand and make sure that we, had lots of resources and help so we didn't have to close our office.
We refurbished this clinic, or we are doing it, and we had the support from them on that respect. There has been support with regards to recruiting family physicians. There has been support with regards to our website. There has been support with regards to our finances when it came to COVID, and PPE supplies. During the COVID, we had a regular communication with the Fraser Northwest in terms of what's our supply, where we are we safe? And I think sometimes all you need from the management is just for them to acknowledge that you're there, you have certain needs, and they keep checking on you.
The education sessions and the supports that they do offer have been really impressive so far. They're always offering some kind of series of education or lecture or whatever. I mean, that's changed recently with COVID, but they've diversified it and put it online, and they've done a pretty good job of offering those resources, so I've been pretty impressed.
I think as a family physician, you're often, in your small group by yourself in a practice or an office, and you don't know who to talk to when, a concern comes up. And the division is right there for you. At the bottom of the emails that we get from the divisions, are you frustrated with anything, is right there. And you click that button and you just complain, and then somebody gets back and says, well, guess what? We have a way to fix that for you. So, when it comes to anything like, overhead costs are going up, how can we help? The division, takes a survey, figures things out, helps advocate for us to get some incentives for that. The virtual care, they're there to respond for you when you need to, and that's the big part.
So when I moved here, I was totally lost. I didn't know who to ask for help. I didn't know who to ask regarding EMRs and billing and the health system even in BC. And it was the division that helped me with a lot of that. It was the division staff, the division members, the other physicians in the community that are linked with the division. And I never appreciated how important that was until I think I looked back on a day which was great from a patient care perspective, and I thought, why was it great? And it was because of all the little tidbits of advice that I'd gotten from ultimately the division. And it ranges from things like the learning sessions that we have online to learn from our other specialist colleagues, the services that we have with the focus groups, And let's not forget that the COVID clinic was an initiative of the division. It wouldn't have happened had the division not stepped up and the members of the division. So it's really been, I think, at the heart of what I'm grateful for, to be practicing in here, to have such an empowered division.
Working here has been so enjoyable that after 2 years, I really did not want to move. We loved the area, we loved the practice, and we bought a home here. And it's our home right now, and we settled here. Population here is a working population, really nice to work for. The area has got a lot of nice things about it. There are lots of trails, hikes around here, beautiful, famous lakes around us. And it's a very, very family-based area. I've got 2 young children. They've been loving it, we love it here. And I think, I don't really ever want to move from here at all.
We have benefited enormously in this clinic with the initiative to actually help fund us by providing a full-time nurse in our clinic. This has been something that we could not have financially afforded to do. To have 2 nurses in our clinic would have been too much. But this allows us to have a very professional nurse, actually not just doing clinic nursing duties all the time, but 3 days a week actually working face-to-face with our patients, our complex care patients. It's enabled us to really improve the quality of complex care.
How do you say how much you love a place without comparing to other places that are not doing as well? It's tough. I think that I can't imagine working anywhere else because of the team of physicians and specialist colleagues we have around us. And the division that is there, very mindful, very much out in front of supporting us and helping us, have the best practice we can. Like, they are there 100% to say, let's make your job easier, let's make you more satisfied, let's keep you from burning out, and to have somebody that is there, that has my back, is just so awesome. This is probably the strongest division of family practice in BC, and if you have a problem, they fix the problem.